understand, can only delay its course. So, and if it were possible to do that without any other costs, then sure, carry on locking down. But it's patently obvious that you cannot do that, that there are profound costs, and these costs are just mounting.
Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Exeter's Medical School. Doctor, you're one of our go-to guys on COVID-19.
Thank you.
I want to ask you first, and I know it might be difficult for you to disagree if you do with a colleague, the epidemiologist we had from Oxford University in that report, do you agree with her that the virus should be allowed to spread and that the most vulnerable just need to be protected?
No, of course. I absolutely disagree with her. I'm sorry to disagree, but I disagree with all my heart and all my thoughts and all my feelings. Let me expand a little bit more. Whatever you do in your so-called safe group will percolate and create a pulse which will then transfer to the vulnerable groups. So you cannot create a planet within a planet and say that our vulnerable group is protected whilst you give a whole free fall to the other groups. The other thing that this group has completely, utterly forgotten to mention is when you get your infection, even if you are a young person, you may be left with permanent damage, permanent disability further to infection. Therefore, what we have to do is don't get infected, don't infect others. The problem here, sir, is this. The governments have not got the health measures, the public health measures in place, and then they say, you, the health people like me, are wrecking the economy. I say, it is the government leaders who are wrecking the economy by not sorting out the public health measures in the first place.
Don't you think governments have made the calculation by now, and it's just a matter of time before they mostly start saying the same thing? We can't afford to shut down completely. We accept that there are going to be a certain percentage of deaths, but we're going to accept that percentage of deaths because our economy cannot be allowed to crash.
Yeah, and what I say is this, there's a lot of homework that should have been done, but they failed to do. And the homework is as follows. And I openly say this, that closing pubs, for example, in the United Kingdom, is just symbolic. And many of these control measures are purely symbolic. What you need to do is you say, you allow businesses to continue, and at the same time, you keep people safe. How do you do this? Good public health messages, good control measures such as you go to pubs, bars, restaurants in a safe way. You make them safe. You wear masks. You have hand washing. You have ventilation. You have crowd control. And if you really don't want to take those lessons, look at the examples of Vietnam, Taiwan, China, South Korea. They are managing to do it. They are not doing what the Barrington Report appears to want to say we do.
But do you not think that these measures are being taken? I mean, whether it's in these countries where COVID-19 has almost disappeared, or whether the countries where it's surging, like we're looking at Europe at the moment, do you not think that everything is being decided on the basis that a vaccine is coming? Because what happens if we don't get a vaccine? It's not guaranteed yet. How much do things change about the way society is going to reconstruct itself if there isn't a vaccine?
Well, I think we should never put our eggs in the vaccine basket, because even if it were to arrive today, we would not be in a position to vaccinate a large, representative, vulnerable group for many, many months, if not a year. And also, we may have to be repeatedly vaccinating because we don't know how well the vaccine lasts. So important public health measures are that you reduce human-to-human contact. That is the main basis of controlling this infection. It's as simple as that. You get your basic biology, your infection control in place, and then a lot of things can happen provided you want to address this, which is reduce your connections with other humans, have good hand hygiene, have good ventilation, and reduce your interactions in pubs, restaurants, and social places where it happens. Otherwise, what you're actually advocating for is many people just die. That can't be right.
Dr. Bharat Pankhania, as I said,
Thank you.
thank you so much indeed for sharing your expertise with us. Appreciate it very much.